So good morning students, welcome to Medicine and Chemistry classroom. So today we are going to discuss the second part of antiviral agents, that is pyrimidine nucleosides and nucleotides. So first we will have a look at the structure of iodoxuridine. So its trade name is Toxil. Look at the structure. Its IUPAC name is 5-iodo-2-deoxyuridine. What is uridine? Uridine is a glycosylated pyrimidine analog containing uracil attached to a ribose ring. So it is a glycosylated pyrimidine analog containing uracil attached to a ribose ring. So what is uracil? Uracil is pyrimidine 2,4-dione. Pyrimidine 2,4-dione is uracil. So its corresponding glycosylated unit is known as uridine. So the basic structure of iodoxuridine is deoxyuridine. So first position of pyrimidine nucleus is connected to 1' position of the ribose sugar. So it is a deoxyribose sugar. Clear? So it is a nucleoside containing halogenated pyrimidine and it is an analog of thymidine. Mechanism of action: it acts as antiviral agent against a DNA virus. It is phosphorylated by thymidine kinase to active triphosphate. This phosphorylated drug inhibits the HSV DNA polymerase, which is necessary for the synthesis of viral DNA. Iodine present in iodoxuridine is added to the uracil component and it blocks base pairing. Uses: it is used for the topical treatment of herpes simplex virus keratitis, which cause blindness. And the symptoms of keratitis include eyes cornea become inflamed and pain, impaired eyesight and red eye will be there. Iodoxuridine in dimethyl sulfoxide is used in mucocutaneous HSV infection. It is used only topically due to cardiotoxicity. Next we have thiosemicarbazone derivatives. Example is methizazone. Its trade name is tapazole. Look at the IUPAC name. It is 1-methyl indole 2,3-dione 3-thiosemicarbazone. So an indole nucleus is present in methizazone. What is indole nucleus? Benzene ring fused to pyrrole nucleus. So the first position of this indole nucleus, a methyl group is present. Hence, in IUPAC name starts with 1-methyl indole. And at the second and third positions, 2 keto groups are present. So instead of a keto group at third position, what is the branching or what is the side chain? Thiosemicarbazone is attached. Hence the IUPAC name is 1-methyl indole 2,3-dione 3-thiosemicarbazone. Next classification is adamantane amines. Adamantane inhibits influenza type A infection. These agents interfere with influenza type A replication by preventing the early stage of viral encoding and disturbing the late stage of viral assembly. Look at the structure of amantadine. Amantidine's trade name is Symmetrol. If you examine the structure, we can see that it has a cage-like structure, right? So 3 cyclohexane rings are fused together to form the adamantine nucleus. Amantadine has the IUPAC name is 1-amino adamantane or tricyclodecan 1-amine. Its uses include Parkinson's treatment of Parkinson's disease. Dose is 200 to 400 milligram. By increasing this, so the mechanism of action is by increasing dopamine level and thereby block receptors for acetylcholine. For normal motor or muscle control, acetylcholine and dopamine levels need to be balance carefully. So you might have studied under Parkinson's disease, right? Then this amantadine is also used against influenza type A virus, parainfluenza, and some RNA virus. And the dose is little bit different, that is 100 milligram twice daily in adults. Next adamantane amine is rimantadine. Its IUPAC name is alpha methyl 1 adamantane methylamine. Its mechanism of action is it acts by inhibiting virus specific RNA. Uses it is active against influenza A virus, ADR, dizziness, dry mouth, loss of appetite, and dose is 100 milligram twice daily. Moving on to the miscellaneous agents. First we have phoscarnet sodium. Look at the structure. It is a trisodium phosphonoformate. Its trade name is Carnet, and its mechanism of action is phoscarnet sodium is in an inorganic pyrophosphate analog, and it inhibits replication in herpes virus and retroviruses. And it is a reversible non-competitive inhibitor at the pyrophosphate binding site of the viral DNA polymerase and reverse transcriptase. They inhibit the cleavage of pyrophosphate from deoxynucleotide triphosphate and incorporation of nucleotide triphosphate into DNA. It does not require bioactivation by viral or cellular enzymes. And its dose is 60 mg per kg every 8 hours for 14 to 21 days. It is used in the treatment of cytomegalovirus retinitis in patients with AIDS. The next one is ribavirin. Its trade name is Rebitol. Ribavirin is also known as tribavirin. 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 Look at the structure. What's the nucleus present in ribavirin? It's a triazole, right? It is 1,2,4 triazole. 1,2,4 triazole. And its IUPAC name is D-ribofuranosyl 1H 1,2,4 triazole 3 carboxamide. Its third position, the third position of triazole nucleus is attached to carboxamide CONH2 group. Clear? Mechanism of action. Ribavirin is a nucleoside analog with a modified base and a D-ribose sugar moiety. The drug is bioactivated by viral and host cellular kinase to give the monophosphate and the triphosphate. Ribavirin monophosphate inhibits inosine monophosphate dehydrogenase, thereby preventing the conversion of inosine monophosphate to xanthine monophosphate, which is required for the synthesis of guanosine triphosphate. And this RTP, that is ribavirin triphosphate, inhibits viral RNA. Uses. It is used in treatment of influenza type A and B, hepatitis, genital herpes, and Lassa fever. Lassa fever is acute hemorrhagic illness caused by Lassa virus. It is transmitted to humans from food contaminated with rodent excreta. So that's all about antiviral agents. We'll continue in the next class. Thank you.